Hey guys, I just wanted to share with you this really cool book I'm reading. My wife and I were really enjoying it. I'm getting really interested in marketing, and I'm getting really more interested in kind of like some of the emotional stuff that goes on when we make purchasing experiences or why we choose one thing over another. Kind of some of the neurological stuff that is going on. And I stumbled upon a bunch of good books in this area. One was Freud on Madison Avenue. I think that's the title of it. Another one was called Biology, B-U-Y, ology, which was really good, which talked about like at a neurological level what is going on and how we're conditioned, like why is there a bread bakery now in every single supermarket when you walk in? Well, it increases the sales of purchases of butter, cream cheese, peanut butter, jelly, etc. So I was kind of interested in like, how am I getting duped? What smells are making me make purchases? What sounds am I relating to things? And I came across this book, which was really awesome. Cloutier Happel, I believe that's how you say his name, wrote a book called Culture Code. I almost said Culture Club. And it was really a fascinating read, and I was totally getting into it. I just wanted to tell you a little bit about that experience. So let's see if I can get this thing to work a little bit here. So he's a pretty famous guy. He's known around the world for some of the weird, crazy, abstract things he does. And one of the things he says is, I don't believe in what people say. And I kind of will touch on a little bit of how our brain works a little bit later. So every culture has an unconscious. So this is the area that he's really interested in, is your unconscious mind and kind of how it functions. And the reason this is important is if you really delve into how people how think on a conscious level, but then also how they make decisions on an unconscious level, you kind of can have a superior product. Here's one of his clients, Boeing, who came up with the Dreamliner, and the thought that he came up with at this time was what people really want to do is get to where they're going faster. But the hard part of that is they have to get to the airport 2 hours earlier. They have to leave an hour early just to go through the traffic. And a lot of these airports, like Chicago, where these big planes are, so people they say that they want more space and more room on a plane, but the actuality is they just want to be able to get out of the car, get on the plane, and go. So Boeing designed a smaller airplane that can land at smaller places like St. Louis or Billings, Montana, etc. Can come in and land and go. So that allowed people to quickly drive up, get out, go through TSA, get on the plane, and take off. That's what people really wanted. But the only way he got there was through a series of basically focus groups and imprinting sessions, and I'll kind of take you there. So here are some of his clients and how he works with them, and you can see they're half of like 50% of the Fortune 500 companies he some way or shape or form represents and or is on retainer for, and he helps them get down to what the meaning of their products and what they really are at a subconscious level. So here's how he kind of does a little of that. So we have the cortex part of the brain, which is your thinking and your reasoning and all this cool stuff that's going on, Then we have the limbic system, and the limbic system, really, if you think about it, the limbic system is your emotions, your anger and fear and stuff like that. Reptilian brain is something totally different. This is your brainstem, and that is basically fight or flight. It's instinct, it's gut feeling. It's you hear a loud noise and you take off, you bolt, and you don't know why you bolted. The important thing is that you're alive, and you can look back and say, oh, that wasn't a lion, that was just my friend clapping some sticks together. Another interesting thing about this is I see some overlay with Aristotle, logos, pathos, and ethos. And logos would be the data. It would be the making your statement to the CFO in the room by here's the evidence, here's what we're going to do. Pathos is the emotion. So pathos is like, we can do this. This is going to save lives. This is yeah, rah rah rah, and it's the emotional part of what we do. That would be limbic. And then finally, there's ethos. This is like that gut feeling that you have, the instinct. This is your reptilian brain, I believe, in a lot of ways. People might say, it's the street cred or whatever, but I think if you can kind of lay these over each other, it's a lot of the same thing that Aristotle was saying back in the day. So this guy really focuses on what he calls codes, and he does that by creating these sessions where he has like a 3-hour session where he lays, he basically gets people in a room, shows them products, shows them things, and he asks them what they think about it. and they kind of say their first level, and then he gets them to the second hour, and then he starts to kind of touch on like what do you feel about it, and then he gets them to this next level where the third hour where they're all laying down, they're comfortable, they're close to, some people might be nodding off, who knows at this time, and that's a good thing apparently. And this is where he gets into the imprint sessions. And he wants to know what was the most powerful experience and the first most powerful experience they had with a product. A good example is coffee. So I think he might have been working for a coffee company at the time. And you don't necessarily drink coffee until you're like, 18 or maybe earlier, maybe 14 or something like that. But is that your first memory of coffee? What is your first memory of coffee? Where with the most powerful imprint at your reptilian brain? And the participants would start to dive into this, and they would say it was smell. It was coming into the kitchen, and Mom was there making me breakfast, and I could smell the coffee. And so what he would do, what he does then is he turns around and says, "Hey, we took all these interviews. We have 200 of them from these sessions, and this is what it's all about. You're selling smell. You're not selling coffee." So now that's why every single coffee place has a roaster in it. You can't drive down the road without smelling coffee now these days, and it's all dark roasted and privately roasted, etc. And I think that's some of the stuff that he really was good at, is getting down to that first reptilian thing. And his theory is you can think something, you can have a feeling about something, but the reptilian brain always wins. That instinct always wins, and that's where these imprints come from. So this is some of the codes for the American culture. So, for example, quality equals it works. Now, think about this later on. I'm going to bring this up again. Some of our first experiences with quality in America is when something doesn't work. We're like, this hunk of junk, it worked 99 times up to then, and then that 100th time it doesn't work, you throw it on the ground. Planned obsolescence, we can just move. We didn't like the farm we lived on. We lived in a big country. We just moved got some more farmland. We just move on. We move to the next product. So really quality means it works, and that's going to be a base level later on. Health, I'm always interested in healthcare. Health for us is just movement, being able to do things. Nothing don't stop us. Don't stop us from doing something. And I think that's pretty fascinating. Youth, we're one of the only adolescent cultures on the planet. We worship, Jersey Shore and all this goofy stuff. Youth, we look at plastic surgery disasters, as I like to say out there, and you look at, Burt Reynolds, these people, he says it equals a mask. It's a very interesting thing in American culture. Money equals proof. So if work equals who I am, money would be your proof. It would be your stripes of what you do out there. This is who I am, work, and this is the proof that I do well at who I am. Food is fuel. This is a very interesting thing. He broke down all these sessions, right? So now look at, I think this book was like 2007, but here this guy goes out endorsing, and look at what our biggest drinks are right now. He goes out advising these guys, and now we have power bars, and we have, Gatorade's massive, and then we have, 5-hour energy drink, and Monster and Red Bull and all this other stuff. So this is pretty fascinating how this guy is actually affecting the products that you own. So my wife and I were sitting around, and we started talking about what is dinner then. And dinner is the essential circle. And we started to think about, in American culture, why dinner, for example, is important. And it might be the only moment that we all get together and we get to kind of like go over the day, talk about things, but it might have deeper meanings. And I think it also ties in with home. So we started talking about, I don't know how we got this conversation, but we started talking about the American kitchen compared to the European kitchen, and it was really a fun little, mind game that we were playing, a thought experiment that we had. So here is an example of like a European kitchen, for example. In Belgium, my kitchen was very, very small. And it was a place where it actually had doors that you had to open the door to go into it, and you could close it off. And Belgium, I lived in southern Belgium, which is very French, and the French don't believe anyone should be in your kitchen except for you. So when you have guests over, they come into the main door, the main foyer, they greet each other, then they go over to another room and they have tea or whatever, and then they move into the dining room. But you would never let anyone back to see your big old mess of preparing and stuff like that. I think we had something that was very similar in American culture. Maybe we had help or something back in like the 1940s, and we kind of kept it all off to the side. And I think as commercial products started to think, how can we get into the kitchen? How can we target that stay-at-home parent who's there at home? How can we give status, access, power, stuff to these folks and sell products? And then what would happen after we did that? So now take a look at the American kitchen. This is the centerpiece of the home. Think about that. Where does everyone gather? Where does everyone hang out? When you have parties, where does everyone gravitate towards? You can actually see people sitting around with glasses of wine talking in this picture. You could imagine the hors d'oeuvres on the table, people telling stories about, oh, when Jack went fishing, etc. So the American kitchen is definitely the centerpiece of our home, and it's made a shift, but how? And I think that's where the status, access, power stuff comes in. When they first started marketing towards the kitchen, and they really started saying this, you need to have this and you need to have that, people wanted to express their status. So what is this really saying? What does a KitchenAid actually mean to you? KitchenAid mixer. Does anyone ever try to buy one of these? They're $350, $400. It's a status symbol. It's a way for Americans to comfortably talk about how much money or how much income they have, how much proof that they have, without saying what your bank account is. So then we had to open up our kitchen. We had to invite people into it to see some of the stuff. So we were having some fun thought experiments, and then we started to move into healthcare. Now, I always like to do, I always like to seek, share, and how does that go? Seek, sense, share. How can we take these kind of things that we're learning from this book, and how can we share it and apply it to what we're doing today? How can we add value? So look at this picture. Pretty interesting picture of the ER, and this is healthcare, and apparently everything's an emergency, and it's life and death, just like house, and you need some brilliant people to solve everything. Enough said. Doctor equals hero. So in the American subconscious, when you get everyone together and you sit down and you see what their first imprints and what they really come down to, their stories all equal to hero. Very, very fascinating. Now, I'm not saying this, I'm not being sexist or anything. I'm saying this is the American culture at a subconscious level views the doctor as a hero. Nurse as a mother. Very fascinating. But if you thought back to your first experiences interacting with healthcare, the nurse could be considered the mother figure of the whole thing. And with good reason. We've probably been bombarded throughout history, our childhood, with imageries of something like Mother Teresa or imageries of a nurse helping somebody. So a nurse equates in our brain to that. And so much so that we've actually have hospital systems adopting and developing ways to kind of make that a part of what they do, the culture of what they do. A good example is Cancer Treatment Centers of America. They have the mother standard of care. And I think that's more of like, how would you take care of your mother? You wouldn't just drop her off at the curb, get out, mom, take off. You would walk her through the whole entire process. Think about that. How would you interface your mother with a healthcare system? You drop her off at the front curb. You say, let me go park the car, I'll come back. You'll bring her up, you'll walk her in, you'll sign the papers, you'll do all the things for your mother. And I think this is very important in where we are going with hospitals and hospitality. So listen to this. So when they asked the Americans what they thought of a hospital, we have a conflict. We think of hospitals as a processing plant, and with good reason. When I go into my primary care provider right now here in Anchorage, I walk in the door after, I'm not even talking about the appointment process, I walk in the door and the very first thing I have is like one of those, your popcorn going to see the movie theater line things with the ropes on the side like you're going through TSA. And so you have to walk up, and then in front of me I have troughs, these little sections, and that's where you're going to go in and you're going to check in and you're going to go through some more processes. Imagine like a glass wall. You feel like you're at you're at the horse track laying a ticket down or something, or you're doing a bank transaction you got to slide it underneath the thing. And a lot of that's for HIPAA, and you don't want people to hear you and stuff like that, but it's just like, this is the total process. And then you wait, and then you go through, and then you go through the doors, and then finally you actually have that first interaction. And that first interaction through another door in another waiting room that you're at is with a nurse, and that's your brain automatically says, finally I'm getting someplace. I'm talking to somebody. And then they take you through another door and then into another door into the op room, and they talk to you for just a second and then they bail out. And now you're waiting for what you're here for. The doctor finally comes into the room, and you see the hero, if you will. Well, I think we can think of this whole entire process a little bit different. And now I'm not saying get rid of all the walls and get rid of all the doors, but I'm saying let's look at a way that we can interface a little bit differently. And I like to play this game to point out the complete contrast. So we have something that's good here. We have hero and we have mother, and we have something that's bad here, processing plant. How do we merge these together and make it work? So here's a game I like to play, DMV or clinic. So this one has a little, you could probably look up here and you could see the clinic C, and you know that this is probably the hospital, and then this one you could assume is the DMV. But I can show you tons of these pictures and you will not be able to tell the difference between the hospital and between the DMV. Now remember what I said in one of my other videos on service, where does the word hospital come from? Hospital, hospitality, hostile, guest. We are not doing a good job at this. There's a big difference between walking into here and then walking into a Ritz-Carlton per se. So one of the things I want to really touch on and really express, we hear the word quality a lot. And like I said earlier, quality just means something hasn't broken on you yet. Quality is what is expected. It's functional, reliable, usable. Like I said, this is what is expected in American culture. If you really want to stand out and you really want to be different in American culture, you have to focus on service. You have to make it pleasurable and meaningful. That's how you're going to differentiate yourself from everyone else out there. We expect it to work. So now, who does good service? Who's the gold standard? And this is kind of how I'll shift from some of the stuff into some of the work that we're doing with customer service and design and stuff like that. It's the wow factor. Ritz-Carlton, right? Gold standard in service. The wow factor. That's what they care about. They're about creating memorable moments. So a satisfied customer means you met the expectations. That is it. You did what you expected. Big whoop. You are standard. You are average. So how do you give them the wow factor? That's what you really want to strive for, and that's what good service is all about. So what if we looked and what if we thought a little bit differently about delivery systems in general? Here is Tanana Chiefs and Fairbanks. This is their new hospital, their new clinic. It's absolutely gorgeous. They had input from patients at every step of the way. It's beautiful walls. It's relevant. It's culturally relevant. It's just a gorgeous place that you want to be. You're attracted to this place. You want to be there. You want to hang out. It's not this. Think about that. Create a place like a home, an environment. Here, again, elements from the natural environment. You have birch, you have wood, you have repurposed wood, I believe. You have a fireplace, fire pit hanging out around the fire pit. It is culturally relevant. People want to hang out here. It takes a lot of flow design, like rivers. If you notice up top, they have a lot of, and down low, rivers are a large part of where they're at in this place. Also, this whole entire hospital, there's like wood back here, like wood. I didn't never notice that, wood stacks. So this whole entire hospital is designed to like hang out, to socialize, to have a good time. This hospital is designed like home or a social gathering. Hello, and this is what's beautiful. So now here's my idea for interfacing. HIPAA and the way the rules are make it so we have these actual cards that we go through and they go beep beep and to get into the next level. And what it does is it actually creates silos. It creates barriers, physical barriers that separate, IT from healthcare from the patients from the waiting room, et cetera, behavioral health, you name it. So we have to work twice as hard to kind of break down those barriers. We have to create an interface, and here is a really good example of what I see going on right now in healthcare. I was just at Providence, and I was pretty impressed with this. Why not bring the nurses, the mother, out and create that interface? Some sites call them patient navigators. They might have different relevancy wherever you are and what you're doing. But what if we did this? What if we, instead of having them hide behind the thing, open up the door and say, Janice, which, by the way, you shouldn't be doing. What if they went out and they interacted and you had one patient full time? Customer service, you have the option here to really change perspective on healthcare and changed it from that mentality of a processing plant. So what if you had this? This is an oncology hospital where the nurse is working the room and they're navigating, helping the patient. Here's a good example off to the side, talking about here's what we can do. Here's another example. Here's some that become more culturally relevant. You have a navigator in your healthcare system, perhaps Sitka or whatnot. Again, here is another Aboriginal folk with a very same thing going on. And I think this is the future of healthcare, and this is what we really want to do, because in the end, maybe we can change the word hospital equals processing plant to hospital equals home, hospital equals friends, hospital equals essential circle, hospital equals gathering. And that's my vision for tomorrow. Thanks.